Hello, I'm here with a very relevant topic for women, that is menopause. Menopause is the stopping of menstruation and absence of ovulation, that is, no eggs are formed henceforth. So, the usual time for menopause in women is around 45 to 55 years. We know that a woman's life is divided into childhood, then she attains menarche around 10 to 14 years, and then there is a reproductive age group where there are reproductive capabilities, there is formation of eggs, there is capability of childbearing, there are a lot of hormones which are to an extent protective for a woman, and after that is the period of menopause, which is inevitable in any woman's life. So one has to look at it positively. So I would just like to tell you a few changes that happen during menopause. Menopause is a natural phenomenon wherein the formation of eggs stops and the ovaries stop functioning, thereby the hormones come to a very low tide. The estrogen, the progesterone, some very key hormones in a woman's life and a woman's health, which play a very crucial role in woman's health, they are at the lowest ebb during the perimenopausal period. The menopause can happen anytime after 40, which is known as early menopause, and there is something known as a premature menopause, which can happen after the age of 30. And premature menopause should make one think about other hormonal disorders like problems with prolactin, problems with thyroid hormones, etc. And premature menopause is an entity which requires medical help, which requires extensive investigation and a hormone replacement as well. But normal menopause, if someone has altered menstrual cycles, the alteration in the menstrual cycles, it can be maybe in the form of sparse menstrual periods, like not getting regular cycles. Some women have very high blood flow or a lot of bleeding during the menstrual cycles. There may be various forms of menstrual irregularities which ultimately culminate into no menstrual cycles, and no menstrual cycles for 1 year would be defined as menopause. And any bleeding that has happened, any vaginal bleeding that happens after 1 year of stoppage of menstruation has to be taken very seriously, because it may be an early sign of a cancer. So 1 year, if the menstrual cycles have stopped, that can be defined as menopause. So let us see what are the changes that happen during menopause. The estrogen is the key female hormone which comes to a very low level. The progesterone comes down, and as a result, lot of changes happen. One is hot flushes. It can be extremely distressing to a woman. You can have a feeling of heat all over your body followed by sweating, and this can be a couple of times a day, 1 or 2 times, it's okay, you can just have a dress change and move on. But if it happens 7, 8, 9 times when you are at work, when you are in a meeting, when you are talking to your client, it can be very disturbing and distressing. In fact, many women express a loss of confidence in working due to this phenomenon. So this is known as hot flushes. Then you have a vaginal dryness, wherein the intercourse may be painful and there can be recurrent episodes of urinary tract infections. Apart from that, there can be a lot of psychological changes like depression, anxiety, panic disorders, etc., where it has a little. Let us look at the social background as well. This is the time when the women retire from their services, they go into their new role of maybe homemakers, the children go away from home. So all this creates a lot of psychological impact and a negative psychological environment, plus the impact of menopause. Women start thinking and they are no longer useful, and they no longer can engage in any fruitful activities, which is not true at all. So these are a couple of psychological changes. Apart from that, there are some metabolic changes that happen. One is slowing down of metabolism for various reasons, and so there is a tendency to put on weight, especially the central obesity, that is a weight around the tummy. Weight around the tummy we know is not healthy at all. That is not a healthy form of fat deposition which can lead to lifestyle diseases in future. Estrogen to an extent protects a woman against heart disease, and once the estrogen comes to a low level, the women are equally at risk of having a heart attack as men. That is, after menopause, the risk of having a heart attack increases in women. Then there is a risk of osteoporosis or weakening of bones, thereby putting them at a higher risk of getting fractures. So these are a couple of things, couple of changes that happen with menopause. There is an increased risk of cancers like breast cancer after menopause. So these are a few medical issues that women have to understand. So how do we go about? First is having a very positive attitude. We know that the changes in life are inevitable. We have to take those very positively and move on. It's not, some people describe it as a twilight in a woman's life, but let us look at it in a different way. It gives you more free time to engage in more social activities, more hobbies like singing, dancing or painting, which you were not able to pursue due to your busy lifestyle till menopause. So it's a time, let us look at positively, that it's a time to engage in new activities, discover a new you within yourself. So a few physical aspects that you need to take care of are, one is a healthy diet. As I told you earlier, hormone replacement is not for everyone, but there are some natural hormones called phytoestrogens which are available in lot of plant products, for example sprouts, soya products, etc. So let us include these food items more in our daily diet. Go low on refined carbohydrates, go low on sugars, go low on fatty foods. Let us engage ourselves in daily physical activity. Phytoestrogens may be given in the form of powders or capsules, which can also take care of these hot flushes and certain physical problems that women go through during menopause. If we take the vaginal dryness, recurrent urinary tract infections, there are estrogen creams that are available. These creams have to be used very short term under medical supervision, that I would like to emphasize. And apart from that, taking a calcium vitamin D supplement always helps in preventing osteoporosis and thereby the risk of imminent fractures. So these are a couple of things that women need to take care of, apart from engaging in periodic testing, that is look out for lifestyle diseases, assess your cardiac risk, your risk of heart attack, then we have a self-examination of breast to look out for any breast lumps. In case of a suspicious lump, bring it to medical attention as early as possible. These are a few things that one must do in order to take care of the physical problems that come with menopause. Apart from that, the psychological issues. Let us stay connected to good friends, friend groups, engage in more social activities, take up hobbies, and let us look at it as a very good time to engage in socially meaningful activities, because the responsibilities at home, responsibilities for the family are sort of less than what it was 10 years before. So this is a good time to rediscover yourself, rediscover a new you within yourself. So hope this video helps you to look at menopause in a positive way and discover a new person, a new you within yourself. Thank you.